Well, I have a lot of hands-on experience, patient contact. I'm in the critical care units every day, monitoring these patients, at the bedside with the doctors and the nurses, making sure that the patient's medication therapy is most appropriate for that patient. People who think of a pharmacist, they think of a retail pharmacist behind the counter filling prescriptions. And as a hospital pharmacist, you do fill medications, within the hospital, but it's a completely different type, and you're not behind the counter. There's a lot more physician and nursing interaction than you would have in a retail setting. Well, within hospital pharmacy, there are a lot of career options you can choose. You can specialize in different patient populations, whether it's pediatrics, internal medicine, surgery patients. I myself chose critical care patients, which are patients that are in the intensive care units. And what I do on a daily basis is make sure that if a patient has an infection, that the antibiotics that they're using are appropriate for the infection that the patient has. Also, like many of these patients will have problems with their kidney function or liver function, and so we'll make sure that the medications are dosed appropriately based on how well the kidneys or livers are functioning. In high school, I was always interested in sciences, mathematics, and in actuality, I had thought about going to medical school, and then I was talking to my father, and he suggested pharmacy as a degree. And so as I looked into it further, I realized that there are a lot of career opportunities within the degree of pharmacy. It wasn't until I chose pre-pharmacy in college did I start taking classes towards that degree. Okay, well, besides my daily monitoring of patients, I'm also working on lots of protocols throughout the hospital, which involve medication safety, patient safety. One in particular is our glucose management program, which is a program which will hopefully manage our diabetics' glucose better throughout the hospital. Through this protocol development, I feel like I can really make a difference for not only the intensive care patients, but also patients throughout the hospital. I think the best traits for a pharmacist is, you have to be somewhat intelligent to get through the coursework, but also you have to have integrity and conscientiousness within you, because you're dealing with medication therapy, and that's a very serious part of patient's therapy. I think healthcare is going more towards an interdisciplinary approach, where you have the physicians at the patient bedside along with the nurse, the pharmacist, the dietitian, and the respiratory therapist. And you have all those angles, looking at the patient and coming up with a therapeutic approach for that patient. Looking at medication therapy, I feel like I do make a difference because, as a pharmacist, I'm the medication expert, and I can help the nurse as well as the physician as far as, offering different options of therapy for that patient.